Hello, my name is Adri Lopez, and I want to inform you about the process of organ transplant. Within the course of this speech, another person will be added to the national transplant waiting list of over 116,000 people who need a transplant because an organ inside of their body is failing them. Today, 20 people will die waiting for an organ. A record number of organ transplants have been done for the past 4 years, and the trend is increasing. It is important to know about the organ transplant process in the event that a loved one or yourself would be put in this situation. Being knowledgeable helps to ease the stress and set individuals up for success in the process that can be scary. I've spent time researching the topic in order to best inform you of this process. Today we will talk about the history of organ donation, the process to diagnose and receive an organ, and what life looks like after a transplant. First, we will look at the history of organ transplant in order to better understand where it began and how far it has come to where it is today. Organ transplants have come a long way since the very first successful transplant in 1954. The most common and best recorded history is that of the kidney, liver, and heart, so those are the organs we will discuss throughout this presentation. The kidneys are two bean-shaped organs that excrete waste from the blood, balance bodily fluids, and begin to process urine formation. When a kidney begins to fail, there is a reduction in urine output, edema, shortness of breath with no explanation, fatigue, nausea, and other symptoms that may point to needing a new kidney. The first successful transplant was done in 1954 by Dr. Joseph Murray in Boston. It was done on a set of identical twins. One was dying of kidney disease and the other was healthy. Though this was a huge advancement, it created many ethical issues at the time because you had to harm one patient in order to heal another. The Hippocratic Oath says that medical professionals are to do no harm, and an organ transplant from a live donor was hard for some to swallow. Larger issues were at hand at the same time with the need to help limit organ rejection. Doctors tried to use things like x-rays, which sometimes killed the patient due to radiation exposure, drugs like immunosuppressants to try to stop organ rejection, and better tissue typing techniques so the match would be better from the start. The introduction of cyclosporin, which is an immunosuppressive drug, was huge in the success of transplant for all organs we will discuss. The liver works in the body to metabolize drugs within the blood. It also produces bile as well as helps to carry away waste and break down fats in the small intestine. Some symptoms that may point to needing a new liver are abdominal pains, yellowing of the skin and eyes, which is called jaundice, joint pain, abnormal skin spots, confusion due to copper buildup in the body and brain, and muscle wasting. Liver transplants were first done in dogs in the 1950s in the country of Italy. The first human transplant was done on a pediatric patient by Dr. Thomas Starzl in 1963, but unfortunately the patient died from uncontrolled bleeding during the operation. In 1967, he tried again and successfully transplanted a liver into a 19-month-old girl who survived for a whole year after the transplant. Until the 1970s, the process was still experimental, and only about 25% of the patients survived an extended amount of time. The use of immunosuppressive drugs made transplant much more successful in the following decades, and now 73% of those who receive a transplant are still alive 5 years later. The heart pumps blood via the circulatory system so the body can be supplied with oxygen and nutrients and removes carbon dioxide and other waste products. Without the heart, other organ tissues would be starved of oxygen and die. Shortness of breath, chronic coughing, edema, fatigue, nausea, confusion, and high heart rate are all symptoms of organ failure. Dr. Christian Bernard performed the very first ever human heart transplant in 1967 in Cape Town, South Africa, but they did not live long after the operation was over. There are many deaths shortly after transplant, so over the next 20 years, there are more advancements in tissue typing and immunosuppressive drug use, allowing for more successful operations when it comes to heart transplants. The first pediatric heart transplant was done in 1989 on a 4-year-old boy who lived until 2006 when he was killed by another health issue. Next, we will discuss what the entire process of waiting for an organ looks like, from the diagnosis and placement on the waiting list to actually undergoing surgery and getting a new organ. There's a long process that goes into getting an organ that can take from months to years to get to the end. The process can be scary but manageable if you are informed and diligent to the plan of care. Once a diagnosis is made, your physician will need to make a referral to be evaluated for a transplant program as a potential candidate. While waiting on an evaluation, it is important to gather information to learn about the process. The United Network for Organ Sharing is a great resource for education. Next, you must select a transplant center that is compatible with your needs, with insurance, financial needs, and support resources offered. It is vitally important to understand the financial process and insurance needs so that an organ transplant can happen quickly and swiftly. Almost every state in the United States has a transplant center, so it is just a matter of finding one that works the best for your needs. Once you have selected a center, you will have to schedule an evaluation in order to be placed on the list for an organ and meet the care team that will see you through the process. On the medical side of things, when it comes to finding an organ for a person, there are procedures that must be followed in order to find a good match. The Organ Procurement and Transplant Network has policies to regulate how donors are matched and where patients sit on the waiting list. When matching organs, they look at blood type, severity of the patient medical condition, distance between the donor hospital and the patient hospital, just the ability for organs to only last so long outside of the body, and patient waiting time. An organ can come from a living or deceased person. A living person can give kidneys and part of their liver or lung when they are still alive. There are as many living donors as there are deceased donors each year. Deceased organ donation comes from people who are brain dead, where all of the organs can be used, or another situation like an accident that leaves the organs undamaged. There are 125 million people registered to donate their organs, but only 3 in 1,000 of those 125 million actually become donors when they die. Each organ has specific needs for transplant. A heart is matched to a patient based on their urgency. The heart can be outside of the body for only 4 to 6 hours and are often given to those that live closest to where the organs are harvested. Body size is very important because organs must fit inside the chest comfortably in order for this transplant to be successful. Kidneys need additional factors to match, which are called lymphocytotoxins, and they must cross-match between the donor and the recipient. They also must have a number of HLA antigens in common with the donor. Kidneys can be outside the body for 36 to 48 hours, so they can be further dispersed geographically based on need. Those who need a liver transplant are assessed for their urgency to get a new organ, and we will go to those with the highest score on various tests. There are some geographic issues, but not as much as with a heart, but more than with the kidney because livers only last 12 to 15 hours outside the body. The actual surgery to place a new organ is different for everyone. The process of connecting all the veins, arteries, and nerves is intricate and takes hours to get correct. Each organ surgery is unique to the organ and the case of the individual. Kidney transplants take anywhere from 2 to 3 hours to complete. The original kidneys are typically left inside of the body, and the new kidney is attached to the bladder through its own ureter. Liver transplants take between 4 and 8 hours in order to remove the old one and sew in the new one with all the appropriate attachments. The entire liver can be transplanted as a whole, or sections can be used. Heart transplants last approximately 4 hours, and the person is on a heart and lung machine to keep the blood pumping throughout the entire body. As you can see, the heart is laid in the body like this and sewn in through the back. Follow-up care is important for all organ transplants and lasts for years and looks similar for each organ. People must start immunosuppressant drugs after their surgery and will continue for months to stop the body from rejecting the new organ. These drugs weaken the immune system of the person, so they are vulnerable to infection for a very long time. It is important to choose a good pharmacist that is accessible and helpful to you on the journey of a new organ. Overall, it is important to stay healthy after a transplant in order to speed up recovery and stay healthy for longer. This can also help the longevity of the organ and avoid needing another transplant. It was my intention to interview a kidney transplant recipient to get a first-hand account of what it is like to receive an organ, but in the past few weeks she has struggled with organ rejection herself and was unavailable to be interviewed. We've discussed what the history of organ transplant looks like, the process of receiving an organ, and learned about what it is like to live after the transplant. By discussing all of these topics, I hope you have gained a better understanding of what organ transplant looks like as a process of getting to live a better, fuller life for the recipient. More information about organ transplant can be found on many reliable websites, such as the Mayo Clinic and government websites that are put out by the Department of Health and Human Services. Thank you.